Hi all. Today our class is going to be about direct gold restoration. Talking about from examination point of view, it's a very important question that can be asked even in your second year and also in your final year. So when it comes to second year, mostly it will be focused on your material aspect, whereas you are coming in your final year, probably there will be more importance given to your cavity preparation. Okay. So this is a very detailed presentation of this concept, but probably for an undergraduate level you can just pick up one or two few slides and study for the exam. Okay, so I'll quickly go through this PPT. Starting with the contents, as I always tell, any question, the first thing that you have to do is put a content box, which will help you in getting clarity of what you're going to write, and it will also help in fetching you more marks. Okay. So introduction, direct filling gold is one of the oldest filling material. You just take a direct gold and just take a gold and fill directly into the cavity. It requires a lot of clinical skills because you are directly doing it in the patient mouth. So the one of the main advantage of this material is that it can be cold welded at room temperature. That's very unique property. What is cold welded? It is nothing but you can actually strain harden, like by putting some pressure, like beating and rolling process. All these will tend to increase the strength and hardness of the material, and this is a unique feature of direct filling gold. Talking about history, not all of them is important for you, but the things which you have to know is Robert Arthur of Baltimore, who actually described the corrosive nature of the gold. And apart from that, you should also know about R.V. Williams, who gave this electroalloy, and Baumann Lund, who gave this EZ gold. Okay. And characteristics, as you already told, it has got excessive corrosiveness. I will be talking about what is corrosiveness in the next few slides. And apart from that, it's an inert material, so good corrosion and tarnish resistance, softness during manipulation, cold welding, and it has got a good hardness number and malleability and ductility. And apart from that, these are some physical properties. No need to memorize everything. Just know what is the melting point and boiling point for this gold, and CTE value and density, of course. Advantages, as I already told, it is most durable, resistant to tarnish and corrosion, insoluble, and good adaptation to the cavity wall, and it has got a good edge strength. And disadvantages, it's a very technique sensitive procedure. It requires a lot of clinical skills, and of course, it is not an aesthetic material. It has got a high thermal conductivity because it's a gold, right? It will conduct so much of heat and cold. So pulp protection is mandatory if your RDT, that is remaining dentin thickness, is going to be low. Okay. And indications, you'll indicate these in cases which has got a very limited dimensions, limited width and the depth, and where the margins can be located on the sound enamel surface, and the teeth which has got a sound pulp dentin complex, and the teeth which has got a good oral hygiene and low caries and plaque index. Contraindications, obviously, if there is a very periodontically weakened teeth, caries prone teeth, and economic, if the patient is not able to afford, and skill of operator is questionable. All these cases, these are few contraindications. And this is not required. It's nothing but biological considerations, nothing but what are the things which you have to keep in mind when you're doing this restoration. As I already told, you're going to do it directly into the patient mouth, right? So you'll be using a lot of condensers to condense this material. So this energy of condensation might cause some damage to pulp dentin complex, and the thermal energy, frictional heat when you get doing the finishing and polishing, and sometimes your galvanic currents will happen. Supposingly, if you're placing an amalgam and opposite a gold is there, something called as a galvanism will start and resulting in galvanic corrosion. And as I already told, you have to give adequate pulp protection, and this depends upon the factor called as an RDT, that is remaining dentin thickness. So these are few values. You can make a note of it and you can write in a separate heading. It's very important. And talking about the material aspect, this has been already covered by Dr. Charanya in one more video. So I'll just quickly brush up through this. So we have basically three types: fibrous, crystalline, and granular gold. It's a very important question for second year. So in fibrous, it is available as sheets, pellets, cylinders, ropes, laminated, platinized, and corrugated. And a crystalline, it's matte gold, matte foil, gold calcium alloy, or otherwise called as the electroalloy. And granulated gold is golded. It's a very important classification. Do not forget this to write. And this is how it is available. And annealing is a procedure which will make the gold more corrosive. This is again a separate important question. So they will ask you classification. What is annealing? So we'll talk about that in next slide. So this is how it is available, like pellets, cylinders, rolls, and all. And there's something called a corrugated gold, platinized gold, and laminated gold. It's nothing but platinized gold is nothing but they're going to sandwich a gold along with the platinum, thinking that platinum is going to make it more resistant to tarnish and corrosion, wear, and hardness also. Okay. And yeah, this is the thing. You have the actually three forms of gold: cursive, semi-cursive, and non-cursive. So cursive is nothing but a purest form of gold. For example, if you want to combine two sheets of gold, it has to be in its utmost purest form. That is called as a cursiveness. Then only when you do this condensation procedure, it will be able to attach or adhere to each other. Okay, this is called as a cursiveness. So gold is considered to be cursive when its surface is pure and free of surface oxides. Semi-cursive, non-cursive are nothing but impure form. Non-cursive is when there is so much of impurities like sulfur and phosphorus gases on it, which makes it unable to adhere to the adjacent gold sheet. Okay, so that is non-cursive. And semi-cursive is that intentionally they will treat this cursive gold with materials like ammonia to prevent them from premature coercion of sheets. Okay, so that is semi-cursive. You have to write all these three, and for a cold welding procedure it has to be in cursive form, and it is not possible to always maintain in cursive form. Sometimes it will become non-cursive or you will make it semi-cursive. So in order to remove these impurities, you will do something called as an annealing procedure. Okay, so these are the other forms which I told: matte gold, matte alloy, electroalloy. So this is very important. They will ask you what is electroalloy. It's a combination of gold and calcium content is how much they will ask, and what is the need for adding a calcium content. It increases the strength by dispersion strength. So powdered gold. Yeah, this is what I told, annealing. So it's nothing but a procedure that is done to remove the surface impurities, which will help them in making more coarser. So these are the various methods by which you do the annealing. So alcohol flame directly will place it in the flame, or bulk annealing in a mica tray, and electrical annealing is the most standardized method. It's very, very important. You have to write completely all the methods, what is the advantage, disadvantage, and everything. Okay, it's a very important short note. And yeah, now coming to your manipulation part. So I told direct filling hole is something which you are going to directly condense into the cavity, right? So you have to do this condensation procedure more properly, so that to make sure it adapts well into the cavity floors and walls. And that should also, you have to make sure you have the minimal amount of voids in it. So these are the various type of condensers which are used to condense this gold into the cavity. So these are different types of condensers available. So they have a serrated surface to increase the surface area, and also to create some lateral forces which will help in fulfilling the objectives of condensation. So these are the various shapes of condensers: round condensers, bayonet, parallelogram, and foot condensers. So these are various methods of condensation. Condensation alone separately can be asked for a final year exam. So hand pressure, you directly put it with the hand, give this manual hand pressure. There are some mallets available like hand mallets, and sometimes automatic mallets are also available. And there is something called electrical malleting and pneumatic malleting. Okay, so these are different methods of condensation. So now it's very important. The diagram of various mallets available. Okay, now talking about the principles of condensation, this is very important. Always make sure when you are condensing the gold to the cavity wall and floor, it should be 45°, and to the previously condensed gold, it should be 90°. Always you have to do something called a stepping procedure. What is stepping procedure? Supposing if you are starting at one point of gold, you have to go to the other line angle and come back to the same previously condensed gold. This means you have completely condensed the previously placed gold pellet or whatever it is. So that is also stepping procedure, and you have to always make sure you use a minimal amount of increment, not the bigger one. Okay, so and always the energy should be like less energy the center of cavity preparation, more energy towards the periphery. Okay, so these are the various diagram. Option A is nothing but 45° angulation to cavity wall and the floor. And for the diagram B is nothing but 90° to the previously condensed gold. And diagram C is called as a stepping procedure. Okay. So this is not consideration. So this is a general step. So yeah, first tie formation. Tie is nothing but joining two line angles with a band of gold, and banking is nothing but joining your wall with the floor, and shoulder is nothing but joining two walls. Okay, and paving of restoration is nothing but you have to slightly overfill the gold at KO surface margin, and surface hardening is nothing but you use a rectangular condenser with a maximum condensation pressure to remove the excess gold, and you do burnishing to make the surface smooth, and margination. Margination is nothing but to remove the excess gold. Burnishing, contouring, finishing, and polishing. Oh, these okay. Now, cavity preparation guidelines. This can be rarely asked as a question. Even if it is asked, you just need to know about what are the various cavity forms. In class one cavity, you have simple class. Sometimes there is a compound, complex class one cavity preparation. Only thing you have to make sure is that your cavity, it has to be like what is a sharp line angles and point angles is must for this gold filling restoration. Only if it is sharp, you will get an access point for placing your condensers. These are the diagrams, class 2 cavity preparation, anatomy. This is very important. In class 5 cavity, you have four designs. One is Ferrier design, one is pen handle, one is unilateral and bilateral mustache, and one is a crest shaped cavity. So Ferrier is nothing but it looks like this, a trapezoidal shape axis cavity preparation. And see, diagram A is your parallelogram. Option diagram B, C, D. C is nothing but a unilateral and bilateral mustache, and D is your crescent-shaped cavity. Okay. And class 3, for a class 3, again 3 designs are available. One is the Ferrier design. It happens in the proximal surface of your tooth. And the other one is your lower linear design, which slightly extends onto your lingual surface, or sorry, labial surface, to make it more incisal retention. And finally is an Ingraham design. Okay, so this is recent advances. That's a stop of gold. It's a new restorative material which is being introduced, and it's found to be more denser than a granular gold. So with that we complete this direct filling gold. It's a very important topic. Probably you can refer your Anusavis, Craig, and even Mahalakshmi ma'am book. So it's all clearly given, and for your cavity preparation you can refer your students. Okay, thank you.